How are you all? I hope you are doing good in this COVID time. So, welcome to Baby Chakra. This is Dr. Swetha. I'm a consultant obstetrician and gynecologist working for Lakshmi Healthcare Hospital, Vanasthalipuram, Hyderabad. So, today I'll be discussing about the Trimester Wise Care that is to be taken during pregnancy. Okay, I'll try to be as brief as possible as well uh, as easily understandable as possible. Also, I'll be answering a few questions. You can also post your questions there in the chat box. So that will be of a great help to me. Okay. So roughly, yes, I've already started getting these questions. So I'll brief upon, the trimester wise care. Okay? First, there are three trimesters roughly throughout the pregnancy: first, second, and third. Okay? First 3 months, we call it first trimester. 4, 5, 6 months, that is second trimester, and 7, 8, 9 months is the third trimester. So, in the first 3 months, it's very important to get diagnosed first. So, soon after you miss your period, you have to get your pregnancy test done. So, in case it is positive, you have to consult a doctor. Or if you find it difficult to get a home pregnancy test done, you can consult your nearest doctor and take proper guidance for that. And in addition to the UPT, if it is positive, it's also important to get a scan done. And getting the first trimester dating scan is very important because even in case your periods are irregular, dating scan would be of great help in deciding the delivery time. So in the first 3 months, once you get the dating scan done, dating scan is nothing but that is an ultrasonography, which is used to calculate. We usually calculate the dates. We get the estimated, approximately the approximate estimated date of delivery, which is plus or minus 1 week with the actual date of delivery. Which corresponds to your LMP, that is your last menstrual period. So, in addition to getting an ultrasonography by TVS, that is transvaginal scan, we also call it as internal scan. That is better relatively compared to the transabdominal scan. And the fetal heart also appears as early as 6 weeks in the transvaginal scan. So that can be dating scan. By doing this dating scan, we can also check the viability of the fetus as well as the date. So these two are very important things. Another important thing which we can get through this dating scan is the location of pregnancy, whether the pregnancy is within the uterus or whether it is ectopic pregnancy. In case of ectopic pregnancy, the pregnancy hardly lasts for 4 to 8 weeks, and then in case it is in the tube or in the ovary, it there is a very high chance that it might end up in rupture. So it's always better to diagnose the location of the pregnancy. And coming to the second trimester, and as well as I'll talk about the diet. Okay, all the fruits and vegetables have to be taken, and especially in this COVID time, where there are dramatically increasing number of COVID cases. All I request all the pregnants to remain home unless there is an emergency or unless you have any antenatal checkup. I strictly advise you to remain at home. Okay, as well as in case there is any person any family member suffering from either cold, cough, or any other fever or any other of these symptoms, then you have to wear a mask and try to remain isolated as much as possible and avoid gatherings. This is very important because if you contract infection during pregnancy, when your immunity is already low, it leads to it might lead to complications, and it might be a little difficult to treat one on pregnancy on one hand and these complications on the other hand. It's a little difficult to treat. So, talking about food, all the fruits and vegetables, unless you're diabetic, if you're diabetic, it's better to avoid fruit juices. But you can take less sweet fruits like apples or say guavas or kiwis, all these things, or citrus fruits. These can be taken, and try to avoid juices because once you take the raw, raw fruits or fruit. If you consume fruits directly, that can lead to um, formation of the bulk in the stool. So, constipation, which is very common in pregnancy, can be avoided by taking fresh fruits, but consuming and avoiding fruit, sweetened juices or fruit juices. And in case you're diabetic, in case you're suffering from diabetes, that is wherein your blood sugars are very high, it's always better to avoid fruit juices. But you can have kiwis and less sweet fruits. You can also have papayas, depending on the blood sugar levels. And it's also important to get OGTT done. OGTT is nothing but oral glucose tolerance test. This is a test which is specific to pregnancy, wherein we give some 75 grams of glucose and we check blood sugars before in the fasting state as well as after giving this glucose. So this has to be within the normal limits for the pregnancy to continue without any to be uneventful. And it's also important to monitor the HbA1c levels. That is something which gives an idea about the sugar levels in the previous 3 months, 3 to 4 months. So that is something which has to be done in pregnancy. And other important blood investigations include blood group, viral screens, and your sugar levels, complete urine examination. And if it is positive, it's always better to get a urine culture done. And in the first trimester, once you enter around 11 to 14 weeks, then the scan would be NT scan, that is nuchal translucency scan, wherein we check for the baby's nasal bone development as well as the thickness of the the translucent nuchal translucency, which is seen behind the neck. This is very important. It gives a rough idea about the major neurological anomalies, as well as it's a combination test. There's a combination which goes with the NT scan. It's called as double marker, wherein it's done with blood, and this is a test wherein it gives a rough idea about the major brain diseases. Uh, I've already spoken about the food intake, and it's important to take lots of water and keep yourself hydrated throughout the pregnancy, because there are lots of blood, physiological changes which occur in the blood, and the volume increases as well as there's so many changes. The cardiac output increases. All these things will require adequate hydration. And there are also the liquor. The water around the baby has to be maintained. In dehydrated case, the liquor might go down. So these are the things which have to be taken care of. So coming to second trimester is roughly fourth, fifth, and 6 months. Okay, so till 28 weeks of gestation, we consider it as second trimester. In the second trimester, coming to the investigations, we have to like in case of primaries, the first pregnancy, if it's your first pregnancy, you'll be able to feel for little fetal movements, just like that's called as quickening. You can feel for some flicker kind of a thing that's happening in your womb, abdomen, lower abdomen basically. So that's the period that happens. Quickening happens little early in second gravida or in multigravidas. And coming to the investigations which we do in second trimester mainly include early TIFA. That is something which is done before TIFA, between NT scan and TIFA scan. It's called as early TIFA. It's done between 16 and 18 weeks. And 1 month after that, that is 4 weeks after that, around 20 to 22 weeks, we go for TIFA scan. And after that, between 24 and 26 weeks, ideally between 22 and 26 weeks, there's one scan called as fetal 2D echo. That means we screen for major anomalies in the baby's heart. It's done on the abdomen, but we actually screen for the baby's heart diseases in case there are any major diseases like septal defects or any transposition of the great arteries or all these things. We have a little idea whether the development of the heart is good or not. And it's also important to take TT injection, TDAP. That's what we give. The two doses have to be taken with a gap of 4 to 6 weeks. And also, it's also important to get your vaginal examination done for any infections or the length of the cervix. That is very important. In case there are conditions wherein the cervix might be open or it might be short, wherein we usually do a prophylactic cervical surplus. That is, we put a stitch on the cervix so that we prevent the preterm delivery. Okay, and coming to the third trimester, that is from 7, 8, 9 months till delivery. It comes at a third trimester. This is the period where we get these fetal Doppler done and growth scan done. And in case there is any abnormality in the scan, that is, say, decreased liquor or any other problems like uh, any other problems, in case we come across these things, or in case there is increased liquor, then we tend to repeat the scan maybe in 1 or 2 weeks, depending on the clinical situation. And food, I told you all the food can be taken, but then depending on your OGDT status and blood sugar levels, your food has to be controlled. And all the fresh fruits and vegetables, milk has to be taken, eggs have to be taken, and you can also have dry fruits. And mainly, keeping yourself hydrated is one of the best things that you can do. You should always take about 4 to 5 liters of water in a day, be it juices in the form of juices or milk or buttermilk, anything of that sort. So this is briefly about all the three trimesters. So I'll be discussing about the questions. Let me have your questions. I'll be taking questions now. Okay. I have a question from Lakshmi Mishra. What extra care should a pregnant woman take in this COVID period? Hi Lakshmi Mishra, hope you're doing good there. So, COVID situation, everyone has to wear a mask without fail. Nowadays, when you go out, doubling up of the mask, either a cloth mask with a surgical mask, or using any of these two masks, cloth mask with N95 mask, it's always better to wear an N95 mask so that you get an extra protection. And coming to vaccines, it's not proven yet, but then we usually avoid vaccines for the first 3 months, that is in the first trimester. And lactating women can also take vaccines, be it Covishield or Covaxin, anything, whichever is available. It's better to get vaccinated after your delivery, if you are in the third trimester. If you are in the first trimester, please wait for the first first trimester to get over and avoid social gatherings. Try to remain isolated and have a healthy diet and properly and freshly cooked diet. And you take multivitamins. Anyways, these are the iron, calcium, all the supplementations. These will be anyways prescribed, so not to worry much. Madhavi, I have a question from Madhavi. Can I travel in second trimester? Madhavi, traveling is not considered so safe in any trimesters because there might be complications, especially in the first trimester. There can be spotting or bleeding or spontaneous miscarriages, and second trimester also they can have preterm deliveries, and third trimester they can have leaking PV, that is watery discharge from the PV, or it can also trigger labor or bleeding can also be seen in the last trimester. Always better to avoid travel, train or flight. This is safe. Try to avoid flight in the first 3 months. So this is with the travel. It's always better to avoid bumpy roads and all. But now considering this COVID, it's safe to remain home. I have a question from Durga. अगर नॉर्मल डिलीवरी चाहिए तो क्या करना चाहिए? If this is your Hi Durga ji, if this is your first pregnancy, we always give a trial for normal vaginal delivery. But then, depending on the complications, if it's a breach or if there is any discrepancy if there is CPD, that is when there is any discrepancy between the pelvic dimensions and the baby dimensions, that is if you have a very big baby And when the weight is more than 3.5, and this is the first delivery with inadequate pelvis, that is when your pelvis bone is small, uh, that cannot accommodate the baby, so it will be difficult for you to deliver vaginally. As well as when there is no liquor, or when the fetal heart rate drops, or when the baby is in distress, or when the baby passes stool inside. These are the conditions where we go for emergency cesarean section. Otherwise, we always give a trial for normal delivery. Sorry. I have a question from Varsha. When should I do my first scan, and are all the tests during pregnancy compulsory to be done during first trimester? Hi Varsha, it's always better to you go for a scan once your pregnancy is confirmed, because as I've already discussed with you, the location of pregnancy is important, as well as the dating. I mean the expected date of delivery, whether it is matching with your LNP or whether there is any change in it. These are the things as well as the viability, whether there is fetal heart or not. These are the things which we get an idea about in the first scan. So it's always better to get a scan as soon as your pregnancy is confirmed. Trisha says, is 12 weeks the same as 3 months? Okay, normally women tend to calculate uh, 3 months as 12 weeks, 4 weeks a month. But our calculation would be different. We calculate from the LMP. So you can count from the LMP. I have a question from Trisha. Can I hurt my baby by sleeping on my right side? Okay. So your baby is actually protected, Trisha. There are so many layers around your baby protecting the baby. There is a lot of liquor around it, and there is uterus protecting, as well as there is an abdominal wall protecting your baby from getting hurt. But then we usually advise you not to sleep on your right side. That's because your sleeping flat or on the right side can lead to decreased blood flow to the baby, because of the compression of the blood vessels can lead to um, decreased blood flow to the baby, as well as there can be your swollen foot. Okay, so that's the reason we advise you to sleep on your left side. Sorry. I have a question from Riddhi. बेंडिंग पोजीशन में बेबी को हर्ट होता है क्या? एक्सक्यूज मी. बेंडिंग पोजीशन में बेबी को हर्ट नहीं होता, but bending or unsupervised exercises like sitting down or doing any lower abdominal exercises have to be under strict doctor supervision, because that can lead to complications like draining PV or bleeding PV. So this has to be very cautiously done. So I think I've finished all the questions. Thank you very much, everyone, and thank you, Baby Chakra, for giving me this opportunity to discuss with you about the Trimester Wise Care. And in case you have any questions, you can post on my page, and you can always consult me online on Baby Chakra.